Hello and welcome to my YouTube channel. My name is Elian Bridget Osareti and I'm a 500 level nursing student that loves Jesus. On this Christian channel, we post nursing tutorials, and as at now, we are on our med search series where we would be taking the pathophysiology of every disease conditions in all systems of med search. We also post DIY hair videos occasionally, so you can check that on our shorts. So, if you are new to this channel, you are very welcome, and please stay tuned. And if you are an old subscriber, I love you. Anyways, don't forget to like, share, and subscribe if you gain any knowledge from this video. And please also leave your questions in the comment section, and I promise I'll respond to every single one of them. Today we are going to be learning
the pathophysiology of rhinitis.
So without further ado, let's hit the start button.
Rhinitis. When you hear the word rhinitis, what's the first thing that should come to your mind? It should be inflammation. Why? Because of the word itis, as in itis. In medical term, itis means what? Inflammation. So when you hear the word itis in any word, it means there's an inflammation of that particular area. So now, what is rhinitis? Rhinitis is an inflammation of the nasal lining that may lead to runny or blocked nose. Now, to find out more on inflammation, you can check out my previous video covering inflammation. Now, let's learn a little about the anatomy of the nose. Now, the nose or the nasal cavity is the major entrance or exit for the respiratory system. The nose is divided into the external nose and the internal nose. The external nose is made up of hyaline cartilage, and then it has skeletal surface structures that help to create the appearance of the nose. It's also made up of the root, the bridge, and the apex. Then as for the internal nose is also known as the nasal cavity. And this internal nose consists of a large irregular cavity that is divided into two by the septum. The nasal cavity has a lining of vascular ciliated columnar epithelium that contains mucus secreting goblet cells, and these mucus help to moisten the air that we breathe. Now that we know a little more about the nasal cavity and its lining, let's go back to our topic of today, rhinitis. We said rhinitis is an inflammation of the nasal lining that leads to a runny nose. Now, what are the types or classifications of rhinitis? Rhinitis can be classified into the non-allergic and allergic rhinitis, and we also have acute conditions and chronic conditions. Allergic rhinitis occur when the body's immune system mistakenly identifies a typically harmless substance as an intruder. The substances are usually known as allergens. An example of these allergens are dust, perfumes, even food, pollens from flowers, and even cold can cause an inflammation of the nasal lining. This allergen may cause the body's immune system to release histamine and chemical mediators that may cause the symptoms in the eye, nose, and throat. Also, people with allergic rhinitis are prone to allergic conjunctivitis or eye allergy, and allergic rhinitis can make asthma worse for asthmatic patients too. Non-allergic rhinitis usually affects adults and causes year-round symptoms, and the immune system is not involved in the symptoms. For allergic rhinitis, it's important to note that seasonal allergic rhinitis, also known as hay fever, is caused by pollen carried in the air during different times of the year and in different parts of the country. Some causes or factors that may predispose a person to having rhinitis include environmental factors. Example, we have change in temperatures, change in humidity. Then we also have odor or food. Like I told you before, perfumes also may predispose a person to rhinitis. Then infections of any kind or a presence of a foreign body, age, systemic disease, drugs, for example, cocaine, and chronic use of decongestants may predispose a person to having rhinitis. Now, for the general pathophysiology of rhinitis, there must be a causative agent first of all. So this causative agent, whether for the allergic rhinitis or for the non-allergic rhinitis, the causative agent will cause an inflammation or irritation of the mucous membrane of the nose. And this inflammation will cause hyperstimulation or hyperproduction of goblet cells. And as you know, goblet cells, they are mucus producing cells. So they will cause nasal itching and sneezing in an attempt to get rid of the irritant. This sneezing and itching will cause increased mucus production. And once there is increased mucus production, there will be nasal congestion and nasal discharge of the mucus. Once there is nasal congestion and discharge, there will be continuous irritation. That's if the whatever is causing that inflammation is not removed. If there is further irritation, there will be continuous rhinorrhea. And this rhinorrhea may occur as excessive nasal drainage or running nose. And if causative agent is not still removed, the causative agent may find its way to the brain and it may lead to fever and headache. Some signs and symptoms of rhinitis may include rhinorrhea, and this rhinorrhea may be due to irritation, continuous irritation of the nasal lining, and is usually seen as excessive nasal drainage or running nose. It may also include nasal congestion, which may be due to excessive mucus production. It may also lead to nasal discharge, nasal itching, sneezing, headache, and fever. That's if the microorganism or the causative agent enters into systemic circulation or find its way to the brain. Now, for the management of rhinitis, both medical management and nursing management, the management of rhinitis depends on the cause and is identified using the history and physical examination of the patient. For viral rhinitis, medications are given to relieve the symptoms. For allergic rhinitis, a test is done to identify the allergy and the severity of the allergy in order to know, and sometimes corticosteroid may be given too. General drug therapy include antihistamine given for sneezing, itching, and to relieve rhinorrhea. Then oral decongestants also are given to relieve nasal obstruction. Intranasal corticosteroids are given for severe congestions to relieve it. And then ophthalmic agents are also given to relieve irritation, itching, and redness of the eye. For the nursing management, physical assessment must be done and observation too must be given in order to know the general state of the patient, and so it can act as a baseline data for further management of the patient. Then admission may also be done, but usually admission is given based on severity, but most patients are treated on outpatient basis since the hospital environment may also be a source of irritants to the patient. Then as for the health education is also very important too, and it will help to avoid and reduce exposure to allergies and irritants. For example, dust, animals, foams, odors, powders, sprays, tobacco smoke. So you educate the patient so the patient will avoid those things and in order to prevent further irritation. Now this should take us to the end of today's tutorial on the pathophysiology of rhinitis. If you are still with us, thank you for staying to the end. Don't forget to like, share, and subscribe. I love you.